What is the difference between eCQMs and CQMs, and what is the level of manual abstraction required for each option?
Oh, great question. The first thing that leaps out of that question is the concept of manual abstraction. If you need to or want to do manual chart abstraction, you cannot do eCQMs. eCQMs are electronic only, no abstractions allowed. In fact, the electronic data for eCQMs can only come from certified EHR technology, that is CEHRT. If you want to report electronically from any secondary source like a diabetes registry or cardiovascular registry or laboratory information system, you can't do eCQMs. In fact, I think that there are commonly used systems that put your eCQM submission at risk. We commonly use practice management system data to generate denominators. And we commonly get data from reporting databases or clinical data repositories for numerator data. Now, if you're using those systems as part of your eCQM submission generation, your practice management system and or your data repository may not be certified and could put the validity of your submission at risk. It would not be the kind of thing that Medicare would notice unless it took a deep dive into your submission technique. So successful submission in the past may not be adequate assurance that you'll continue to be able to do it this way. Now, a little bit more on the differences. When you're referring to CQMs, you're thinking MIPS CQMs or Medicare CQMs. They work off the same specifications and dynamics as each other, except that the MIPS CQMs draws from all patients and all insurers of all providers' practices in the ACO. Medicare CQMs only includes Medicare Part B patients and only if they've seen a primary care provider in the primary or secondary list of primary care providers from any of the practices in the ACO. Now, eCQMs uses different specifications that is limited to standardized electronic clinical concept sets. eCQMs are all patients of all payers. eCQMs must be all electronic with no manual selection or manual editing of the data. If you need to edit data for an eCQM, you have to go back to the core data, change it there, that is the legal electronic record, and then rerun the analyses. Now, the three techniques are also benchmarked separately. eCQMs are benchmarked and scored only in comparison to other eCQM submissions of the same measures. Likewise, MIPS CQMs are measured and are benchmarked and scored against each other, and Medicare CQMs we expect to be scored and benchmarked against each other. eCQMs are exclusive. You have to be all electronic for an eCQM submission. You can't use any manually abstracted data or any manually edited data, and no electronic data from non-certified sources. In contrast, MIPS CQMs and Medicare CQMs can use any valid data from any source. They can edit and combine data sources without any risk of invalidation. These CQM submissions can be all electronic from and only from certified EHR sources, just like eCQMs, but they can also be all electronic data from non-certified sources. They can be all manually abstracted data, and they can be any combination of those sources as long as you appropriately identify and deduplicate patients in those data sets.